Hi, it's Dr. Stephen Greenberg along with Sarah here at Greenberg Cosmetic Surgery. What we're doing today is an injection of the cheekbones. Now, this patient wants to have a little bit more fullness here. When we use fillers of the face, there's so many different areas we can place it. One is the cheekbones to give a little bit more prominence. Sometimes we'll do the temple area for those patients who have a little bit of sunken in area in the temple. Often we'll do the folds here or the marionette lines as well as the jawline. Those are very common areas to do, particularly as the patient ages, where we tend to get a little bit of a jowl. Not that you have a jowl, but the jawline is a great area to inject. Often we'll give a little chin prominence, and sometimes we do what's called a non-surgical nose job. And the non-surgical nose job is an injection of the nose to camouflage the bump. But in this patient today, what we're going to use is something new called Versa Plus. There are a whole bunch of different types of products that we can inject. The Juvederm company has a whole bunch of different types of injectables, and we use different Juvederm products depending upon what area of the face we want to inject. Similarly, the Restylane company does the same thing. They have multiple different products that we can use depending upon the area that I'm trying to fill. And Radiesse is a nice way to do cheekbones or fill up different areas of the face as well. So today we're going to be doing something new called Versa Plus. And Versa Plus is a hyaluronic acid product that does very nicely to help fill the cheekbones and some other areas of the face. So we want to accomplish a little bit of a fill here, nothing too unnatural. It's all about looking natural. And this is a pretty quick and simple procedure. It goes down like that. And you'll see in a second, we'll have a little bit of a fill there. And very nice little bit of a fill to give a prominence of the cheekbone. This tends to do very nicely, and the patients go back to normal activities immediately. So if you can look at the cheekbone a little bit in this patient, there's a little bit more fullness here on this side. And we rub it out, and it really looks great right away. We hold a little pressure so we don't get any bruising. Now what we're going to do is switch to the other side, and you'll see similarly we'll get the other cheekbone done. What we like to do is keep just a very nice natural look for the patient without looking too fake or unnatural. Sometimes we'll get a little bit of a bruise, but in most patients they don't have any bruising at all, and we tend to ice this a little bit. And this is simply a cheekbone fill. Very simple, nothing too crazy here. And let's just check the other side, and that looks very nice. So you can see if the patient has a little bit of a bump, we just massage it out and it goes away quickly. And that's it. So you'll see now in this patient, she has a nice little bit of a cheekbone there and gives a nice look. If she wanted, we can do some fill down here as well. But this area for now is a quick and simple thing to do. This is Dr. Stephen Greenberg.